Welcome to our deep dive today.
Okay.
We are going to be looking at a pretty hefty document called Project 2025,
Uh-huh.
specifically Section 3, Chapter 14.
Right.
This lays out
Yes.
a roadmap for reforming the Department of Health and Human Services, or HHS.
Right.
If a conservative administration takes office in 2025,
Yes.
it's a very ambitious document.
Yeah.
It covers everything from the CDC
Uh,
to the FDA,
Right.
even proposing to eliminate entire programs like Head Start.
So their stated goal
Yeah.
is to get HHS back to serving the health and well-being of all Americans at all stages of life. But I think what's interesting is how they plan to achieve that,
Okay.
especially when you look at the 5 core goals
Yeah.
that kind of drive all of their proposed changes.
Okay.
You
So
know what I mean?
let's start with those goals.
Yeah.
What's the foundation of their vision?
So the first one centers around protecting what they call life, conscience, and bodily integrity. And essentially, this reflects a strong pro-life stance,
Yeah.
emphasizing the sanctity of conscience
Yeah.
and traditional views on biological sex.
So you can already see how this is going to
Yeah.
potentially lead to some clashes
Absolutely.
with current policies on things like reproductive rights and transgender health care.
The second one focuses on empowering patients and providers
Okay.
with a strong emphasis on kind of free market principles.
Hmm.
They're arguing that healthcare costs would go down
Yeah.
and quality would go up if there was more competition and less government regulation.
So less red tape.
Right.
More freedom for individuals and their doctors to make decisions. So
Yeah.
it sounds like they want to shrink the government's role.
That's a key theme
Yeah.
running through the document.
In healthcare.
Yeah.
Okay.
The third one is promoting
Mm.
stable and flourishing married families.
Okay.
This section suggests that current HHS policies often undermine marriage and penalize families,
Yeah.
focusing instead on single parenthood.
So it's fascinating how they're
Right.
explicitly connecting their social values
Yeah.
to healthcare policy.
They're arguing that traditional marriage is the bedrock of a healthy society
Yeah.
and want to make sure that HHS policies reflect that belief.
Okay.
Now, their fourth goal
Yeah.
is all about preparing for the next health emergency.
Okay.
They are very critical
Yeah.
of the government's response to COVID-19,
Makes sense.
arguing for more transparency,
Yeah.
more scientific grounding,
Uh-huh.
and less centralized power.
Okay. So that makes sense.
Yeah.
Considering the recent pandemic.
Absolutely.
Yeah.
And kind of all the debates that we've seen surrounding that.
And the fifth and final goal.
The fifth one is all about increasing transparency, accountability, and oversight across HHS.
Okay.
They're particularly concerned about the influence of pharmaceutical companies
Yeah.
and what they call this revolving door between government and industry.
Yeah, that makes sense. So they want to make sure that, profit motives aren't driving healthcare decisions
Right.
and that there's no undue influence from special interest groups.
Exactly.
So
So
we could
you see how these 5 goals,
Yeah.
protecting life,
Uh-huh.
empowering patients,
Yeah.
supporting married families,
Okay.
preparing for emergencies, ensuring transparency,
Right.
kind of become the lens through which they view every single agency
Yeah.
within HHS.
Okay.
Yeah.
So we've got the big picture framework.
Right.
Now let's zoom in
Yeah.
on some specifics.
Sure.
Where should we start?
Well, given all the attention it received during the pandemic,
Yeah.
the Centers for Disease Control and Prevention,
Huh?
or CDC,
Yeah.
seems like a logical starting point.
The CDC is practically a household name at this point.
It is.
What kind of shakeup are they proposing?
They are proposing splitting the CDC
Okay.
into 2 separate agencies. One would focus solely on collecting and publishing data
Okay.
to ensure transparency
Oh.
and prevent political bias.
Okay, so why the split?
Right.
What's the thinking behind that?
They argue that separating data collection from policy recommendations would protect the integrity of the data
Okay.
and prevent it from being misinterpreted or withheld for political reasons,
Oh.
as they claim happened during the COVID-19 pandemic.
So one agency becomes
Right.
a pure data powerhouse,
Uh-huh.
and the other one
Yeah.
focuses on interpreting that data and
Okay.
making recommendations.
Exactly.
What else is on their CDC reform list?
Well, they want to limit the CDC's ability
Okay.
to issue what they call prescriptive guidelines.
Okay.
They think that things like masking or vaccination
Yeah.
should be left up to individuals and their doctors,
Okay.
not dictated by the CDC.
That's a strong emphasis on individual choice
Absolutely.
and limited government intervention.
Absolutely.
Okay.
They also want to modernize the CDC's data infrastructure.
Yeah.
They're arguing that real-time, usable data is crucial for effective public health responses,
Yeah.
but that the current system is kind of outdated and cumbersome.
A tech upgrade for the CDC?
Exactly.
Yeah.
And this ties back into their goal of transparency.
That makes sense to have systems that can quickly process and analyze data
Right.
during a health crisis.
Exactly.
Okay, what else do they want to change about the CDC?
They propose eliminating CDC programs that they say don't respect human life and conscience rights.
Okay.
Specifically, calling for a ban on the use of aborted fetal cell lines in research.
Here we see their pro-life stance
Right.
coming into play,
Okay.
shaping their view of scientific research, including vaccine development.
And they also want to see the CDC promote alternatives to abortion,
Oh, okay.
such as fertility awareness-based methods,
Okay.
arguing that women should have more options.
So they're injecting their social and moral views
Yeah.
into CDC's mission.
Exactly.
Okay.
And finally, they want to improve the CDC's data collection
Right.
on abortion and maternity mortality, pushing for comprehensive reporting from all states,
Yeah.
including details like gestational age, reasons for abortion, and complications.
So they're emphasizing,
Right?
but it seems like they're particularly interested in data
It seems that way.
that supports their stance on abortion.
That's one way to interpret it.
Yeah.
It's important to remember that this document presents
Yeah.
a particular
Right.
perspective
Yeah.
and agenda.
Okay, so we've seen their vision for
Yeah.
a revamped CDC.
Uh-huh.
Now let's move on to another major player
Right.
in the healthcare world,
Sure.
the Food and Drug Administration, or FDA.
FDA is a huge agency responsible for ensuring the safety and effectiveness of drugs, medical devices, and food.
Right.
And Project 2025 has a lot to say about how they think it should operate.
Okay, so give me the highlights.
Sure. What are some of the key changes?
Well, one of their biggest targets
Okay.
is what they call federal laws that shield big pharma from competition.
Okay.
They argue that these laws allow brand name drug manufacturers to delay the entry of cheaper generic drugs,
Okay.
keeping prices artificially high.
So they're taking aim at the pharmaceutical industry
Right.
and what they see as unfair practices
Exactly.
that are keeping drug costs high.
Yeah.
What are some of their solutions?
Well, they propose a number of changes,
Okay.
including one that would prevent brand name manufacturers from doing something called product hopping.
Product hopping.
Have you heard of that?
What's that?
It's when companies will make minor changes to a drug shortly before its patent expires,
Okay.
allowing them to get a new patent
Okay.
and essentially extend their monopoly,
Okay.
even though a generic version could be available.
So they want to ban that practice
Right.
to encourage or to foster
Exactly.
real competition.
Yeah. In the drug market.
In the drug market.
It sounds like they're trying to level the playing field
Exactly.
and give consumers more access
Right.
to affordable medications.
Uh-huh. Okay.
They also want to make it easier
All right.
for generic companies to obtain samples of brand name drugs
Okay.
for testing purposes,
Mm-hmm.
arguing that this would speed up the approval process.
Okay. So less red tape
Yeah,
for generic manufacturers,
Yeah.
which could lead to lower drug prices
exactly.
for consumers.
Yeah.
Okay.
And they also want to limit the use
Okay.
of citizen petitions
Okay.
that they claim are often used to delay the approval.
What are or?
Yeah. Citizen petitions. These are petitions that anyone can file with the FDA, raising concerns about a drug or its manufacturing process.
Okay.
The document argues that these petitions are often used by brand name companies as a way to stall the entry of generics into the market.
Okay, so they want to reform that process.
Right.
To prevent it from being used as a tool.
Yes, to stifle competition.
They want to make sure
Yeah.
that the citizen petitions are legitimate
Yeah.
and based on genuine safety concerns,
Okay.
not just a tactic to protect profits.
Okay. What else is
Break that.
on their FDA reform list?
Another area of focus
Okay.
is the approval process for laboratory-developed or modified medical tests. You know, they learned some hard lessons
Yeah.
from the early failures of COVID-19 testing,
Right.
and they want to streamline the process for tests
Okay.
that are developed in a single lab.
So less red tape for lab-developed tests?
Yeah.
Especially during a public health emergency?
Right.
Yeah.
And they also want to clarify the overlapping regulatory authorities
Okay.
between the FDA
Uh-huh.
and CMS,
Okay.
which is the Centers for Medicare and Medicaid Services,
Right.
when it comes to these tests,
Okay.
to avoid unnecessary delays and confusion.
So streamlining the regulatory process
Right.
and ensuring that tests can get to patients quickly and efficiently.
Exactly.
Right.
They also talk about the issue of drug shortages, pointing out that the slim profit margins and regulatory burdens associated with generic drug manufacturing can lead to shortages.
So it's a supply and demand.
It's a supply and demand problem.
Yeah.
What are their solutions?
What are their solutions?
Well, they propose implementing a graded inspection system
Okay.
for generic drug manufacturing facilities, rewarding manufacturers
Okay.
who exceed minimum standards
Okay.
to encourage
Okay.
higher quality production.
So incentivize better manufacturing practices.
Right.
What else?
They also suggest creating a searchable database
Okay.
that links drug product codes to specific manufacturing facilities
Okay.
so that, buyers could quickly identify drugs made in more reliable locations.
That sounds incredibly helpful.
Especially for
hospitals and pharmacies.
Right.
Yeah.
Trying to manage their inventories and avoid shortages.
Yeah.
And finally, to further incentivize generic drug production, they propose exempting multi-source generic drugs
Okay.
from Medicaid rebate requirements.
Medicaid rebate requirements.
Yeah. Have you heard of those?
What are those?
These are essentially discounts that drug manufacturers have to offer to state Medicaid programs
Okay.
in exchange for having their drugs covered.
Okay.
And they're arguing that these rebates actually discourage investment in expanding manufacturing capacity for generics.
So by eliminating these rebates,
Right.
they can encourage
Exactly.
more companies to invest in producing generics,
Exactly.
which would help prevent shortages.
Right.
Okay.
They believe that removing this financial barrier would ultimately benefit patients
Yeah.
by ensuring a more reliable supply of affordable medications.
We've covered drug prices, lab tests,
Right.
and drug shortages. What else is on their FDA hit list?
This is where things get
Okay.
a little controversial. They call for essentially abortion pills, specifically mifepristone, to be the FDA's initial approval process was illegal.
Here's where their pro-life stance comes into play in a
Nice.
major way, shaping their approach to FDA regulation.
Exactly. And should be reversed. They also want to reinstate stricter safety protocols,
Okay.
including in-person dispensing requirements and aim to crack down on mail-order abortions.
So they want to make it much more difficult.
They want to make it much more difficult for women to access abortion pills, even in states where abortion is legal.
Okay.
They see medication abortion as a major threat to their goal of protecting life.
Okay. What else is on their FDA?
They also touch upon vaccine importation,
Okay.
specifically for those who object to vaccines that were developed using fetal cell lines.
Okay.
So they're arguing that the FDA should allow easier importation.
That's a niche concern, but
Right. It has been a topic of debate,
yeah, it has.
especially in certain religious communities,
Exactly.
of what they consider ethically sourced vaccines.
So they want to give people
Right.
who object to the use of fetal cell lines in vaccine development
Yeah, exactly.
more options for obtaining vaccines that they consider acceptable.
Exactly.
Yeah.
And finally, they circle back to this issue of conflicts of interest,
Okay.
specifically what they call the revolving door
Yeah.
between FDA reviewers and pharmaceutical companies.
So people who review drugs
Prefa.
for the FDA then go to work for the very companies whose products they were evaluating.
Exactly.
Yeah, it does seem like a potential conflict of interest.
They propose implementing a cooling off period
Yeah.
to prevent former FDA reviewers from joining companies
Makes sense.
that they regulated.
Yeah, they want to ensure that
Mitigate.
decisions about drug approvals
Right.
are based on science and safety.
Exactly.
Not personal.
Not personal financial interest.
Financial interests.
Right.
All right, we've covered a lot of ground with the FDA.
We have.
What's our next?
So deep dive.
Let's move on to the National Institutes of Health,
Okay, let's talk science.
or NIH,
Yeah.
where much of the nation's biomedical research happens.
The NIH has been in the news a lot, especially with all the research on COVID-19.
It has.
How do they envision reforming the NIH?
They paint a somewhat surprising picture of the NIH, not as a benign science agency, but as an institution in need of serious ethical reform. They highlight concerns about research using fetal tissue, human-animal chimera experiments, and gain-of-function viral research.
That last one is particularly provocative, given, the theories about the origins of COVID-19.
It all ties back
to their broader concerns about bioethics. Their first priority is to enact a complete ban on research using fetal tissue from elective abortions and human embryonic stem cells.
So a complete shift in how certain research is conducted, driven by their pro-life beliefs.
They argue that these practices are immoral and that alternative research methods are available and more effective. They also want to bring back the National Council on Bioethics to address emerging ethical concerns in research.
That makes sense, especially as new technologies and scientific advancements raise new ethical dilemmas.
Absolutely. And just like with the CDC, they also raise the issue of conflicts of interest.
I'm guessing this is also tied to industry funding and potential bias in research.
They highlight several examples, like the infamous alcohol study that was funded by the beer and liquor industry. And the fact that the NIH holds patents on the Moderna COVID-19 vaccine, potentially leading to financial gains for NIH scientists.
That's a pretty direct link between research and profit. So I can see how that would raise concerns about objectivity.
They argue that these conflicts compromise the integrity of research, and they call for stricter regulations, including term limits for NIH leadership, block granting research funds to states, and increased congressional oversight.
So decentralizing power, limiting the influence of individuals, and increasing accountability. Sounds familiar.
And they also take aim at what they call woke policies at the NIH.
I'm intrigued. What are they referring to?
Specifically, they criticize policies that mandate female representation on scientific panels and promote what they consider junk gender science. They want to abolish the NIH Office of Equity, Diversity, and Inclusion, arguing that it pushes a liberal agenda rather than focusing on scientific merit.
So we're seeing a clear pushback against diversity and inclusion efforts framed as prioritizing political correctness over scientific rigor.
That's a key point. They're arguing that these efforts are actually undermining science. And that merit should be the sole criterion for funding and research decisions.
So we've seen their vision for shaking up the NIH.
Focus on bioethics, addressing conflicts of interest, and pushing back. Against diversity initiatives. All right, where do we go from here?
Well, no discussion of HHS reform would be complete without tackling the behemoth.
That is Medicare and Medicaid.
Let's dive into CMS.
That's where CMS comes in. The Centers for Medicare and Medicaid Services.
These programs touch the lives of so many Americans.
They do, especially seniors
and low-income individuals.
Low-income individuals, exactly.
What kind of reforms are they proposing here?
They start by outlining 4 main goals for reforming Medicare. Increasing beneficiary control. Reducing regulatory burdens on doctors. Ensuring sustainability, and reducing waste, fraud, and abuse.
Those sound like pretty standard goals.
Yeah, those are pretty standard for any government program.
In our program,
So what makes their approach unique?
Is
how they plan to achieve them. For example, they want to increase beneficiary control by giving seniors more choices in how they receive their care, including expanding access to private Medicare Advantage plans. They also want to reduce regulatory burdens on doctors by streamlining paperwork and simplifying billing procedures.
Less bureaucracy. More flexibility.
For both patients and providers. And they want to ensure the long-term sustainability of Medicare.
Okay.
By addressing rising healthcare costs.
Yeah.
And finding ways to make the program more efficient.
Okay, so far.
Yeah.
It sounds like they're taking a market-based approach.
Yeah, I think that's fair to say.
It's Medicare reform.
They believe that empowering consumers and fostering competition will lead to better quality care at lower costs.
Okay, what about their plans for reducing waste, fraud, and abuse?
Okay.
That's always a concern with government programs?
It is.
Yeah.
They propose strengthening program integrity.
Okay.
By implementing stricter eligibility verification procedures.
Okay.
Cracking down on improper billing practices. And holding states more accountable for managing their Medicaid programs.
So tightening up the rules.
Tightening up the rules.
Increasing oversight to make sure that taxpayer dollars are being used wisely.
Taxpayer dollars are being used wisely.
Okay.
They want to make sure that Medicare and Medicaid benefits are going to those who truly need them. Yeah. And that the programs are being run as efficiently as possible.
All right. So we've gotten a taste of their approach to reforming Medicare and Medicaid. Yeah. But we're out of time for today. So stay tuned for part 2 of our deep dive into Project 2025.
Sounds good.
Where we'll continue exploring their vision for the future of HHS and American healthcare.
All right. Welcome back to our deep dive into Project 2025.
Right.
When we left off, we were discussing proposed reforms for Medicare and Medicaid.
Right. And it seems like they're taking a pretty hands-off approach, giving states more control and emphasizing personal responsibility.
Right.
But let's be honest. Yeah. No conversation about healthcare in America is complete without talking about the Affordable Care Act or Obamacare.
You're absolutely right.
Yeah.
Project 2025 doesn't shy away from that either.
Okay.
They argue that Obamacare has made insurance more expensive and less competitive.
Okay.
And they want to see significant reforms.
Okay, so not exactly fans.
Not exactly.
Of Obamacare.
No.
What are some of the specific changes they propose?
So they want to remove barriers to direct primary care.
Okay.
Which is a model where patients pay their doctors a fixed monthly fee for basic care.
Okay.
Essentially cutting out the insurance middleman.
It's like a subscription service for healthcare.
Yeah, like a subscription service for healthcare.
How would that impact insurance coverage?
They see it as a way to empower patients. Lower costs for routine care.
Yeah.
And strengthen that doctor-patient relationship.
Okay.
It wouldn't replace traditional insurance for major medical expenses.
Yeah.
But it could offer an alternative for primary care.
Interesting. So more options for consumers.
Right.
But it seems like it would mainly benefit.
Yeah, that's a valid point.
Those who can afford to pay out of pocket. Okay.
They also want to revisit the No Surprises Act.
Okay.
Which was designed to protect consumers from surprise medical bills.
Yeah, those can be a nightmare.
Right. You go to a hospital.
You go to the hospital.
Thinking everything's covered.
Thinking you're covered, and then bam, you get hit with a huge bill for an out-of-network provider.
Exactly. And so the goal of the No Surprises Act was to prevent that.
Yeah.
But the document argues
that
the law's dispute resolution process, which determines how much insurers have to pay for those surprise bills, is confusing and flawed.
Okay.
They want to replace it with a more transparent system.
So simplifying the process and making it easier for consumers to understand their costs.
Exactly.
Okay, what else is on their Obamacare reform list?
So they also propose facilitating shared savings and reference pricing plan options, which essentially reward patients for choosing lower-cost care.
So incentivizing people to be more cost-conscious when making healthcare decisions.
Right.
Okay.
They also suggest separating the subsidized and non-subsidized insurance markets, arguing that this would allow insurers to offer more affordable plans to people who don't qualify for government subsidies.
Essentially creating a separate market for those who have to buy insurance on their own.
Right.
Without government assistance.
Without government assistance.
Yeah, it seems like that could lead to...
Yeah, that's a potential consequence.
Yeah.
They argue that it would make coverage more affordable for those who are currently priced out of the market.
Okay.
But it could lead to those disparities in coverage.
Okay, what else do they have to say about employment healthcare?
The document also highlights the need to strengthen
Okay.
hospital price transparency requirements.
Okay.
They want hospitals to be more upfront about their prices for common procedures, allowing consumers to shop around for more affordable care.
Transparency seems to be a recurring theme in this document.
Yeah.
They want more transparency in pricing, data collection, pretty much every aspect.
Every aspect of healthcare. They believe that empowering consumers with information is essential for creating a more efficient and accountable healthcare system.
Okay, we've covered a lot of ground.
Right.
From the CDC to the FDA to Medicare, Medicaid, and the Affordable Care Act.
Right.
What other areas of HHS
are they looking to reform?
Their proposals related to emergency preparedness. Given the recent pandemic.
Makes sense.
This is understandably a top priority.
Yeah, COVID-19 exposed a lot of vulnerabilities.
In
our public health system.
Yeah.
What do they want to do differently?
Well, they want to expand the scope of practice for clinical laboratories, allowing them more flexibility to respond to emergencies like a pandemic. So this would mean, cutting red tape.
Yeah.
So labs can quickly develop and deploy tests without waiting for lengthy approvals.
So streamlining the process to ensure we can respond quickly and efficiently.
Quickly and effectively.
To future health crises.
Yes. They also want to create pathways for non-clinical laboratories to obtain CLIA certification equivalency. So this would essentially allow
research labs to perform clinical testing during emergencies.
It sounds like they want to be able to mobilize all available resources quickly when a crisis hits.
Exactly. They learned some hard lessons from the early days of the pandemic. When testing was limited and slow. And they want to make sure we're better prepared next time.
Okay, what else is on their emergency preparedness agenda?
The document emphasizes clarifying the roles and responsibilities of ASPR, the Administration for Strategic Preparedness and Response, and FEMA during national emergencies.
Right. We saw during the pandemic that, there was sometimes confusion and overlap. Between those agencies.
Yeah, which hampered the response.
Defining clear lines of authority. So responsibility. To avoid a repeat of that confusion.
Exactly. And they also want to reform the Strategic National Stockpile, which holds reserves of medical supplies.
We saw how important the stockpile was during the pandemic, but there were also challenges with, distributing supplies and making sure they got
to the right places. They want to address those challenges. Making sure the stockpile's adequately stocked and that supplies can be quickly deployed.
So improving the management and logistics of the stockpile. To ensure that it's
more effective in a crisis.
Yes. All right, so we've covered emergency preparedness.
Yes.
What's next?
This next section is perhaps the most controversial and ideologically driven part of the document. It's titled Life, Conscience, and Bodily Integrity.
Based on what we've seen so far.
I have a feeling we're about to delve into.
You are absolutely right.
Their stance on abortion.
Yes. This section lays out numerous proposals aimed at restricting abortion access.
Let's hear.
And promoting what they call the sanctity of life.
What are some of their key First and foremost, they want to prohibit the use of federal funds for abortion travel. They're specifically targeting a Biden administration executive order that sought to use Medicaid funds.
So a direct challenge to efforts to expand abortion access, especially in states. Where it's been restricted or banned.
They also want to completely defund Planned Parenthood. Arguing that the organization is too entangled with abortion.
It's been a long-standing goal.
A long-standing goal. Of many conservative lawmakers. How do they propose to achieve that? Well, they suggest issuing guidance emphasizing that states are free to exclude Planned Parenthood from their Medicaid plans. They also propose rulemaking to disqualify any provider that performs elective abortions from receiving.
So a two-pronged approach.
Right.
Empowering states to defund Planned Parenthood
Exactly.
And implementing federal rules.
And implementing federal rules.
To block its funding.
To block its funding at the national level.
At the national level.
Yeah. Okay. They also want to penalize states that require abortion coverage in private insurance plans or that discriminate against pro-life healthcare entities.
So using the power of the purse to enforce their pro-life agenda.
Pro-life agenda at the state level.
At the state level. What else is on their list?
So they want to rewrite the Affordable Care Act's abortion separate payment regulation to ensure that insurers collect separate payments for abortion coverage.
It sounds like they're trying to create a clear financial and administrative separation between abortion services and other
healthcare services.
Healthcare services.
Yeah. They want to prevent any commingling of funds that might blur the lines between abortion coverage and general healthcare coverage.
So they're really trying to silo abortion off from the rest of the healthcare system.
The rest of the healthcare system?
Yeah.
They call for a full audit of HHS programs to ensure compliance with the Hyde Amendment, which restricts federal funding.
So a thorough review to make sure that no taxpayer dollars are going towards abortion services.
Even indirectly.
Even indirectly.
Right.
Okay, what about emergency situations?
Right.
Does that ever come up?
They also want to reverse what they call distorted pro-abortion interpretations of EMTALA, the Emergency Medical Treatment and Active Labor Act.
I'm not familiar with that law.
Okay. So
what does that have to do with abortion?
EMTALA is a federal law
that
requires hospitals to provide emergency medical care to anyone who needs it, regardless of their ability to pay.
All right.
The document argues that the Biden administration has misinterpreted this law to require hospitals to perform abortions in emergency situations, even if those abortions violate state law.
So they want to ensure that EMTALA is not used to compel hospitals to perform abortions. Against their will.
Or in violation of state law.
Or in violation of state laws.
Okay.
They believe that EMTALA should be about providing emergency medical care. Not about expanding.
Okay. What else is on there?
Life, conscience, and bodily integrity.
They want to reissue a stronger transgender national coverage determination. Which would prevent Medicare from covering gender reassignment surgery.
So this is where their opposition.
This is where their opposition to
transgender healthcare comes into play.
Transgender healthcare comes into play.
Yeah.
They argue that these surgeries are dangerous, experimental, and lack sufficient scientific evidence to support Medicare coverage.
So a clear stance against what they see as unnecessary and potentially harmful medical interventions. Transgender individuals.
Right. They also want to use EMTALA. You know that emergency medical treatment law we discussed earlier? To protect infants born alive after abortions. Arguing that these infants deserve medical care.
This is a highly controversial issue. It's often framed as born alive legislation.
Born alive legislation.
They're essentially arguing that any infant born alive, even after a failed abortion, should be treated as
a separate patient.
A separate patient.
Entitled to medical care.
Entitled to medical care.
Right. They also call for codifying the Hyde and Weldon amendments into federal law. Making those funding restrictions permanent.
So enshrining their pro-life stance into law. And making it much more difficult for future administrations.
Right. And they go even further. Criticizing what they call the radical redefinition of sex. And calling for a reversal of the Biden administration's efforts to include gender identity and sexual orientation.
So a pushback against the expansion of LGBTQ plus rights and recognition within the healthcare system.
They see this as an overreach of federal power and an infringement on the rights of individuals and organizations who hold traditional views on sex and gender.
It's a clash of values.
Yeah, clash of values and worldviews. With significant implications for healthcare policy.
With significant implications.
And access to care.
And access to care.
What else is on their agenda?
Finally, they call for the rescission of COVID-19 vaccination and mask mandates.
Okay.
Arguing that these mandates violated individual rights.
So aligning with the more libertarian wing of the conservative movement.
Of the conservative movement.
Emphasizing individual liberty.
Right.
And limited government intervention.
And limited government intervention.
In healthcare decisions.
In healthcare decisions.
Okay.
They see these mandates as a gross overreach of government power.
Okay.
And a violation.
All right, so we've covered a lot of ground in this section. From restricting abortion access.
To opposing transgender health care.
Right.
To rolling back COVID-19 mandates.
Exactly.
It's clear that this document lays out
a very specific vision.
A very specific vision.
For HHS.
For HHS.
For one that's deeply rooted
in conservative
social
and moral values.
And moral values.
Right. So we've explored their vision for the CDC, the FDA, the NIH, Medicare, Medicaid, the Affordable Care Act, emergency preparedness, and what they call life, conscience, and bodily integrity.
Life, conscience, and bodily integrity.
What other areas of HHS are they looking to reform?
So let's shift our focus now to the Administration for Children and Families.
Okay, ACF for ACF. Yeah, what's on their reform agenda for this agency?
They start with TNF.
Okay.
The Temporary Assistance for Needy Families Program, which provides cash assistance and other support to low-income families with children.
Okay.
They want to strengthen work requirements.
Work requirements for welfare programs are always a hot-button issue.
Always a hot-button issue.
Yeah, conservatives often argue that they encourage people to get jobs, become self-sufficient, while liberals worry that they create unnecessary barriers.
That's the heart of the debate.
Yeah.
They also want to increase transparency and accountability, ensuring that states are using TNF funds effectively.
Which are?
So
to achieve the program's goals?
Those goals include promoting work, reducing out-of-wedlock pregnancies, and encouraging two-parent families. So we're seeing
their social values reflected in their policy goals.
Reflected in their policy goals.
They want to use TNF not just to provide financial assistance, but also to promote
their vision
of a healthy
family structure.
Okay,
so they're focused on work requirements, transparency, and promoting their vision of family values. Within TNF. What else?
They then move on to address two other ACF programs.
Okay.
The Teen Pregnancy Prevention Program, or TPP.
Okay.
And the Personal Responsibility Education Program, or PREP.
Teen Pregnancy and Personal Responsibility.
Right.
It sounds like we're back in the realm.
Yeah, we're back in the realm of
conservative social values.
Conservative social values.
Exactly.
Well,
they want to ensure that these programs promote sexual risk avoidance.
Okay.
Emphasize parental involvement. And don't promote abortion.
Okay.
They're arguing that current approaches are too permissive and don't sufficiently emphasize abstinence.
So a more conservative approach to sex education.
Right. Focusing on abstinence. Rather than harm reduction. Or comprehensive sex ed.
Like comprehensive sex ed. Okay, so they want to shift the focus. Of these programs.
What else? They also call for abolishing the approved curriculum lists for sex education.
Okay.
Arguing that these lists stifle diversity approaches and often favor what they call sex promotion textbooks.
So giving states and local communities more control over the content of sex education.
Which could lead to a wider range. Of approaches. From abstinence only to comprehensive sex ed?
Exactly. They believe that parents and local communities should have the primary say in what their children are taught.
So we've tackled TNF, teen pregnancy prevention, and sex education.
What else is on their map? ACF reform agenda.
They delve into the issue of adoption reform.
And how does that fit into all of this?
They want to repeal an Obama-era regulation that prohibits discrimination based on sexual orientation and gender identity in adoption and foster care.
So they're framing this as a religious freedom issue.
Arguing that
faith-based agencies should have the right to operate
Exactly.
According to their beliefs.
According to their beliefs.
Even if those beliefs exclude same-sex couples from adopting or fostering children.
That's the crux of their argument. They believe that the government shouldn't force faith-based organizations to violate their religious beliefs.
Okay.
Even if those beliefs are discriminatory.
It's a complex issue.
It is a complex issue.
Yeah.
With no easy answers.
Yeah. Pitting religious freedom.
Pitting religious freedom.
Against the rights.
Against the rights.
Of LGBTQ plus individuals and couples.
Of LGBTQ plus individuals and couples.
Okay, what other areas of ACF do they target?
Next up is the Office of Refugee Resettlement, or ORR.
A refugee resettlement.
Yeah.
This seems like a pretty specific issue.
A pretty specific issue.
What's their concern with ORR?
Well, they argue that ORR has strayed from its original mission of helping refugees integrate into American society.
Okay.
And has become entangled in what they see as facilitating illegal immigration.
Okay.
They're particularly critical of ORR's role in releasing unaccompanied minors into the country, claiming that these children are often placed in dangerous situations.
So they see ORR as part of the problem.
Exactly.
At the border.
At the border.
Rather than part of the solution.
Rather than part of the solution.
Yeah.
They argue that ORR's policies are actually encouraging illegal immigration and putting children at risk.
Okay. Their proposed solution is pretty drastic.
It is.
Move ORR from HHS.
Move ORR from HHS.
To the Department of Homeland Security.
To the Department of Homeland Security.
Wow, that's a big shift.
It is a big shift.
Why do they want to move it to DHS?
Well, they argue that DHS, with its focus on border security and immigration enforcement, is better equipped to handle the challenges of refugee resettlement.
It sounds like you're taking a much harder line.
Right. They want to send a message that the U.S. is not a welcoming place for those who enter the country illegally.
Yeah.
Even if they're seeking asylum or fleeing dangerous situations.
Okay, so they want to overhaul ORR.
Right.
And move it to DHS.
And move it to DHS.
What else?
They also want to reform
the
Office of Child Support Enforcement, or OCSE, arguing that the current system is flawed.
Child support is a complex issue.
It is.
With a lot of different
it's a lot of different
perspectives and challenges.
What
are their specific concerns?
So they argue that the current system often pits parents against each other, creating conflict and resentment, rather than focusing on the best interest of the child.
So they want to make the system less adversarial.
Exactly.
More focused on cooperation between parents. Yeah. What are some of their specific proposals?
They suggest a number of reforms. Including creating a child support tax credit to help low-income, non-resident parents. Combining child support and visitation courts. To ensure that both parents are financially and emotionally involved in their children's lives. And developing a smartphone app to track child support payments and informal support.
Those sound like practical solutions. Aimed at modernizing the system. Making it more efficient. And user-friendly.
Yeah. They want to make it easier for parents to meet their obligations and stay involved.
So they want to revamp the child support system. What else is on their ACF list?
They move on
to
discuss the Healthy Marriage and Relationship Education Program, or HMRE.
Marriage education.
Yeah.
That's an interesting one.
It is an interesting one.
What's their take on that?
So they believe that strong marriages are essential for healthy families and society as a whole. And so they want to use HMRE funding to provide marriage and relationship education.
We just finished discussing how Project 2025 envisions reshaping the Office of the Secretary of HHS to reflect their life and family agendas.
Right. They want to make sure the secretary prioritizes their views on abortion, marriage, and family structure.
It's clear these agendas would have significant downstream effects on various HHS agencies.
Absolutely. It would impact everything from funding priorities to program implementation.
So we've covered the Office of the Secretary. What's next on our HHS reform tour?
Let's move on to the Office of the Assistant Secretary for Health, or OAS, and the Office of the Surgeon General, or OSG.
The Surgeon General, that's a pretty high-profile position. What kind of changes do they have in mind for that office?
They actually propose a pretty big structural change, combining the Assistant Secretary for Health and the Surgeon General positions into a single 4-star position.
Wow, merging two powerful roles into one. Why do they think that's necessary?
They argue that it would streamline the chain of command, create a clearer mission, and ultimately make the office more efficient and effective.
So less bureaucracy and more focused leadership. What about the U.S. Public Health Service Commission Corps? They're the ones who often respond to public health emergencies, right?
Exactly, and the document proposes refocusing their mission to emphasize rapid response deployments during emergencies.
So making sure they're ready to mobilize quickly and effectively when a crisis hits makes sense, especially after the pandemic.
They want to ensure the USPHS is prepared and well-equipped to handle public health emergencies with a clear focus on rapid response.
Okay, so a streamlined leadership structure and a shift in priorities for the Surgeon General's office. What else is on their agenda?
They also want to ensure that OAH, the Office of the Assistant Secretary for Health, promotes what they call life and family values.
There are those themes. Again, it seems like they want to embed those values into every corner of HHS.
Exactly. And in this case, it means they want OAH to prioritize strengthening marriage and sexual risk avoidance when addressing issues like sexually transmitted diseases and unwanted pregnancies.
So promoting abstinence and discouraging premarital sexual activity as the primary solution to those problems.
Right. And they also call for a scientific review of the effects of abortion and gender-affirming care, which they believe are harmful.
So questioning the safety and efficacy of abortion and transgender health.
They believe that more research is needed to understand the potential risks and harms of those procedures.
It's another clear example of how their social and moral views are shaping their policy priorities.
They're essentially saying that these issues should be viewed through a specific lens, their lens, and that scientific research should be conducted to support their viewpoint.
Okay, so we've covered the Surgeon General's office and their vision for OAH. What's next on our HHS reform tour?
Next, they tackle Title X, the Federal Family Planning Program.
Title X has been another political football for years, with conservatives often targeting Planned Parenthood's funding through this program. What do they want to change about it?
They want to shift the program's focus away from providing contraception and abortion services and instead prioritize fertility awareness and what they call holistic family planning.
So a pretty drastic shift in the program's mission. How do they propose to make that happen?
They want to reinstate a Trump-era rule that required strict separation between Title X funding and abortion activities. This rule was reversed by the Biden administration, but they want to bring it back.
So ensuring that no Title X funds can be used for abortions or by organizations that provide abortions like Planned Parenthood.
Exactly. They also want to eliminate what they see as religious discrimination in grant selections for Title X funding, making sure that faith-based organizations that oppose abortion and contraception are eligible to receive grants.
It sounds like they're trying to create a more level playing field for organizations that share their pro-life views.
Right. They argue that current policies favor organizations that provide abortion and contraception, and they want to ensure that organizations with alternative viewpoints have equal access to funding.
Okay, so a major shift in the focus and funding of Title X. What else?
They also encourage Congress to pass legislation that would prohibit Title X grants from going to any organization that performs abortions.
So a legislative push to further restrict abortion access and cut off funding to providers.
It's another example of their multi-pronged approach using administrative, regulatory, and legislative means to advance their agenda.
All right, we've covered the Surgeon General's office and Title X. What else is on their list?
Next, they address the Administration for Strategic Preparedness and Response, or ASPR, and the Strategic National Stockpile. We talked about those earlier in the context of emergency preparedness.
Right. ASPR handles public health emergencies, and the Strategic National Stockpile holds reserves of medical supplies. What do they want to change about those?
They want to clarify the roles and responsibilities of ASPR and FEMA during national emergencies, ensuring that everyone knows who's in charge of what when a crisis hits.
We saw during the pandemic that there was sometimes confusion and overlap between those agencies, so this makes sense.
Exactly. They want to streamline the response and avoid any confusion or delays in the future.
Okay, so clearer lines of authority. What about the Strategic National Stockpile?
They also want to reform the Strategic National Stockpile, ensuring it's adequately stocked, efficiently managed, and used appropriately during emergencies.
We saw how critical the stockpile was during the pandemic, but there were also challenges with distribution and making sure supplies got to the right places.
Yeah. They want to learn from those challenges and make sure that the stockpile is ready to meet the needs of future public health emergencies.
So basically, improving the management and logistics of the stockpile to ensure it's more effective in a crisis.
Exactly. They want to make sure that we're better prepared next time a pandemic or other major health crisis hits.
Okay, we've covered emergency preparedness. What's next on their list?
They then turn their attention to the Office of General Counsel, or OGC, which is the legal team for HHS.
The lawyers, what do they want to change about the legal team?
They want to rescind a number of legal memos and guidance documents that they believe are unlawful or overreach the agency's authority.
What kinds of memos and guidance are we talking about? Give me some examples.
One example is a memo related to the PRP Act, which provides liability immunity for certain actions taken during a public health emergency. They believe this memo was used to unlawfully suspend civil rights during the pandemic, and they want to rescind it.
So they're concerned that the government overstepped its bounds in the name of public health, and they want to roll back some of those actions.
Exactly. They're trying to reassert individual rights and limit the government's power, especially during emergencies.
What else do they target?
They also want to restore the Office for Civil Rights, or OCR's authority over conscience and religious freedom enforcement. They argue that this authority was curtailed under the Biden administration, and they want to empower OCR to investigate and address complaints related to religious freedom.
So protecting the rights of individuals and organizations to act according to their religious beliefs, even if those beliefs conflict with government policies or regulations.
Right. They want to make sure that religious freedom is given strong protection, particularly within the healthcare system.
Okay, so restoring OCR's authority, what else?
They also want to encourage the Department of Justice to repeal legal opinions that allow for abortion funding and access on federal enclaves.
Federal enclaves? What are those?
These are areas like military bases and national parks that are under federal jurisdiction. They want to restrict abortion access in those areas, even if abortion is legal in the surrounding state.
So extending their pro-life efforts to any area where the federal government has jurisdiction.
Exactly. They're trying to limit abortion access wherever they can.
Okay, so we've got the PRP Act memo, OCR's authority and abortion access on federal enclaves. What else is on their list for the OGC?
They want to rescind legal analysis that authorized the COVID-19 eviction moratorium, arguing that this policy was an overreach of government power.
This fits with their broader skepticism of government intervention and their emphasis on property rights.
Right. They see the eviction moratorium as an example of the government interfering with private contracts and property rights, and they want to ensure that similar policies aren't implemented in the future.
Okay, so a rollback of pandemic-era policies that they see as exceeding the government's authority. What else is on their list?
Finally, they want to rescind legal opinions that they believe limited HHS's ability to protect newborns with disabilities and prevent forced participation in abortions.
Protecting newborns with disabilities and preventing forced participation in abortions? These seem like uncontroversial goals. What's the issue here?
They argue that certain legal opinions issued during previous administrations hampered HHS's ability to enforce laws and regulations that protect these vulnerable populations. They want to clear the way for stronger enforcement of those protections.
So ensuring that HHS has the legal authority to act decisively to protect those who can't protect themselves.
Exactly. They want to make sure that HHS has the tools and resources to fulfill its mission of protecting the health and well-being of all Americans, especially the most vulnerable.
Okay, so we've covered the Office of General Counsel and their efforts to reshape legal interpretations and guidance within HHS. What's next on our whirlwind tour of reform proposals?
Next up is the Office of Global Affairs, or OGA.
Global Affairs, that sounds pretty broad. What's their focus here?
They want to elevate the role of OGA by making the director an assistant secretary, which would give them more authority and influence in global health diplomacy.
So raising the profile of OGA and giving it a more prominent role in shaping U.S. global health policy.
Exactly. They want to ensure that OGA has a seat at the table when important global health decisions are being made.
Okay, what else do they propose for OGA?
They also want to make sure that OGA promotes the administration's pro-life and pro-family priorities in all its international engagements.
There are little themes again, but this time on the global stage.
They see this as an opportunity to export their values and try to shape global health policies in line with their beliefs.
So advocating for restrictions on abortion and promoting their vision of traditional family structures in international forums.
Right. They believe that the U.S. should be a leading voice for these values in global health discussions.
It's a clear indication that they see this as a moral crusade, not just a domestic policy agenda.
They believe that the U.S. has a responsibility to promote these values around the world.
Okay, we've covered the Office of Global Affairs. What's next on our list?
Finally, they address the Office for Civil Rights, or OCR.
We've touched upon OCR before. They're the ones who handle discrimination complaints in healthcare, right?
Exactly. And the document highlights two main areas of focus for OCR: conscience enforcement and revising regulations related to Section 1557, Section 504, and other OCR rules.
Let's start with conscience enforcement. What do they want to change there?
They want to strengthen enforcement of conscience protection laws, arguing that healthcare providers should not be forced to participate in activities that violate their beliefs, such as providing abortions or contraception.
So protecting the right to refuse to provide services based on religious or moral objections?
Right. They believe that healthcare providers have a right to act according to their conscience, and that the government should not compel them to do things they believe are morally wrong.
Okay, so stronger conscience protections. What about those other regulations, Section 1557, Section 504? What are those about?
Section 1557 of the Affordable Care Act prohibits discrimination based on race, color, national origin, age, disability, and sex in healthcare programs. They want to revise those regulations to remove protections based on sexual orientation and gender identity.
So rolling back LGBTQ plus rights within healthcare?
They argue that sexual orientation and gender identity are not explicitly included in the text of Section 1557, and that including them was an overreach by the Obama administration.
They also want to restore the Trump-era interpretation of sex discrimination, which defines sex based on biological sex assigned at birth, rather than gender identity.
Right. They want to narrow the scope of these anti-discrimination protections, excluding LGBTQ plus individuals from certain safeguards.
Okay, so a significant rollback of LGBTQ plus rights within healthcare. What else is on their agenda for OCR?
They want to withdraw guidance that mandates pharmacies to provide abortion pills and guidance on HIPAA and abortion that they see as biased in favor of abortion rights.
So making it more difficult to access abortion pills and ensuring that healthcare providers are not required to disclose information about abortion services if they object.
Exactly. They're trying to create more space for healthcare providers who oppose abortion and to make it more difficult for women to access those services.
It's clear that this document is not just about administrative reforms or improving efficiency. It's about enacting a specific social and moral agenda, one that's deeply rooted in conservative values.
You're right. This document lays out a comprehensive vision for transforming HHS, using the power of government to advance a particular set of beliefs about life, family, and the role of government in healthcare.
We've explored this document in depth, covering everything from the CDC and FDA to Medicare, Medicaid, and a whole host of programs and agencies within HHS.
It's been a fascinating journey, unpacking their vision for the future of American healthcare.
So after this deep dive, what are some of the most surprising or thought-provoking elements that stand out to you?
I think what's most striking is how deeply intertwined this vision for HHS is, with a particular set of social and moral values. It's not just about tweaking programs or making the system more efficient. It's about fundamentally changing the way healthcare is delivered and who has access to it based on a very specific worldview.
Right, we saw that in their proposals on abortion, transgender healthcare, sex education, religious freedom, and the role of government in people's lives. These are big fundamental issues that go far beyond just healthcare policy.
Exactly. They're trying to reshape the healthcare landscape to align with their vision of a morally ordered society, and they're willing to use the full power of the federal government to achieve that goal.
And regardless of whether one agrees with their worldview or not, it's crucial to understand the potential ramifications of their proposals. If implemented, these changes could have a profound impact on millions of Americans.
Absolutely. We're talking about access to essential healthcare services, reproductive rights, LGBTQ plus rights, the balance of power between the federal government and the states, and the very definition of what it means to be a family in America.
This document offers a window into a particular segment of the American political landscape and their vision for the future of healthcare. It's a vision that prioritizes individual responsibility, traditional family structures, limited government intervention, and a strong moral compass rooted in conservative values.
And it's a vision that's likely to be fiercely debated and contested in the years to come.
Well said. As we wrap up this deep dive, I think the biggest question that lingers is this: what aspects of HHS truly need reform, and what values should guide those reforms?
That's the million-dollar question. And it's one that each of us as citizens and participants in the healthcare system needs to grapple with, because ultimately the future of healthcare in America is something we all have a stake in.
That's a perfect note to end on. Thanks for joining us on this deep dive.
It's been a pleasure exploring these complex and challenging issues with you.